Hi, and welcome to the Organism series. Today we're going to talk about Borrelia species that are not Lyme disease. The first disease that we're going to talk about is tick-borne relapsing fever. Acute symptoms typically start with fever and chills, headache, and then you develop myalgias and arthralgias. Soon after, patients can have a macular rash with some petechiae, and if it gets severe enough, you'll start to see end organ disease, including hepatosplenomegaly and then lung, CNS, and cardiac manifestations. Because of these invasive phenomena, this disease has a tangible mortality, although early treatment does ameliorate it for the most part. Tick-borne relapsing fever is transmitted by soft-bodied ticks, but the animal vector for them is rodents, and thus transmission usually occurs in areas where rodents are plentiful. In the US, it's endemic mostly to the Mountain West. The next disease process is louse-borne relapsing fever. As the name suggests, this causes a fever that comes and goes. There are different species of Borrelia that are associated with this disease process, but the most common is recurrentis. The species is transmitted by lice, which are pictured here on the left. It's known to be currently endemic to Ethiopia and the surrounding countries, but can be seen in other places, especially among refugee populations from Africa. It's transmitted via body lice, and there's no known animal vector, so it's considered to be localized to the human population. Interestingly, this vector also transmits one of the Rickettsia species, and louse-borne relapsing fever has a high mortality rate, but again, treatment is effective. However, patients who are pregnant are at higher risk for bad outcomes. Diagnosis of these diseases is difficult. It's really important to get a good history, as treatment is usually empiric, and often the diagnosis is not confirmed until later. The gold standard for diagnosis is using blood smears and dark field microscopy. There's a higher yield of organisms if the patient is febrile when the sample is drawn. The other diagnostic test of choice is using paired convalescent serologies, and a sample should be drawn both at the time of presentation and 21 days later, as early false negatives are common. It's important to remember that these antibodies frequently cross-react to common other pathogens like syphilis. Also, if you can draw them prior to antibiotic administration, you may help a little bit with the false negatives. Treatment is relatively straightforward. For tick-borne relapsing fever, a brief course of doxycycline is usually sufficient. For patients who are pregnant, consider using an alternative agent to reduce the likelihood of fetal toxicity. It's also important to note that many of these patients will have Jerisch-Herxheimer reactions, and these can be severe and can even lead to hypotension. For louse-borne fever, a single dose of doxy is usually sufficient. But as with many things that are vector-borne, the best treatment is prevention. So public health agencies and government should focus on reducing rodent and lice populations where people are, especially in congregate settings. Well, that does it for Borrelia species, and in all honesty, it's not the highest of yield organism groups, but it is a popular topic to test on. Make sure to check out the rest of the organism series on the Simon Says channel for other more high yield organisms and interesting facts. Thank you.